Welcome to On-Demand Virtual Care Anytime, Anywhere. My name is Laurence and I work for TELUS Health, and I'm happy to be presenting the virtual care service for you today. For me, the easiest way to explain what is virtual care is probably to compare it with a more traditional approach, so the in-person appointments. So for example, if you wake up one morning and your throat is feeling achy, you want to book an appointment with your family doctor or the walk-in clinic that is nearby. You would have to call them and wait for your appointment. And if you're lucky, 24, 48 hours, you're able to see somebody, but it could also go up to a week or 2 weeks, who knows. Then you have to travel to the clinic, check in, wait in the waiting room, have a consultation, and then travel back. And this, of course, doesn't include the time that you have to spend at the pharmacy if you're having any prescription, referred. In comparison, in virtual care, you only have to open an application and initiate a consultation. Within 30 seconds to 2 minutes, you're going to be referred to a clinician nurse for a first assessment. If there's a little bit of wait at this point, you don't even have to wait on the platform. You can go back to whatever you were doing before, and you will receive a notification when it's your time to see the doctor or the nurse practitioner. So then you could have your nurse practitioner or your doctor consultation, within 5 minutes. And once the consultation is over, if you have any prescription, they are faxed directly to your pharmacy. And usually what happens next is your pharmacy will contact you when the prescription is ready. So you don't even have to wait there. You just have to go pay for your medication and go back home. So the whole thing can take under 2 hours. It's really quick. It's really convenient because you can start a consultation at home during your lunch break in your car if you want. So it's really convenient. So the service is available 24 hours a day, 7 days a week, on holidays, weekends, anytime really. You have national coverage, or even if you're traveling from provinces to provinces, you can have access to the service. It's available in French and in English, and also your immediate family will have access to the service. What we can do on the platform, so you could get, for example, a new diagnostic advice and a new prescription for this diagnostic. If your condition requires more investigation, we could ask you to do a lab work and imaging. The results will be sent back on the platform. You're going to have a follow-up appointment with the doctor. You can also receive referrals to see a psychologist, a psychotherapist, a physiotherapist, or again, to see a specialist doctor. So a dermatologist or gynecologist. Note that the specialist appointments are not done directly on the platform, but we could help you find a clinic nearby that can, see you. We can help you with forms and case management, and we can definitely help you with mental health care. So if you're suffering from anxiety, insomnia, depression, please reach out to somebody on the platform. Somebody will be available to discuss with you. How does it work? So it's really easy. It's on-demand consults, so there's no limit of consultation. Really, you can go anytime you have a question. It's real-time text messages with the nurses and the doctors. There can be image transfer if it's something that can be seen with the naked eye. There's also secure video chat with the nurse practitioners and the doctors, so it's really face-to-face consultations. And you have access to all your health records, so the consultation notes, your prescriptions. If you want to refer back to it, it's available on the platform. And note that these can be also faxed to your family doctor if you want to follow up with your family doctor later, for example. But we do need your consent before sending those. So how to use virtual care? These are top reasons for consultation, but on a complete list of what we can do. So for example, we could help you with respiratory issues, skin conditions, infectious diseases, bladder infections, or screening tests for STDs, digestive issues, and of course, mental and behavioral issues. But there's still a limit of what we can do for you virtually. So if you're experiencing really serious symptoms, we urge you to call 911 or go to the nearest emergency room. If you're not home and you don't know where the nearest emergency is, you can go on the platform and the nurse will be able to, based on your location, find the nearest ones. We can't prescribe you any controlled substances such as narcotics on the platform, and CT scans or MRIs request an in-person assessment to receive those type of referrals. So the demand for mental support is increasing, as you probably know, with the pandemic. The three main reasons for mental health consultations we see on the platform are anxiety, depression, and insomnia. But again, this is not a complete list of what we can help you with. So our patients will reach out to somebody and we will help them by providing advices, medications, or referral to specialists or psychotherapists, psychologists, for example. We also have access, you also have access to bridge programs. So what is a bridge program? Basically is that our in-house specialists will support our primary care providers to help the patients that have more complex health concerns. So if, for example, you're reaching out for anxiety, you've tried a couple medication, nothing is working for you, what our doctors and nurses could do is reach out to the psychiatrist that we have in-house, discuss your situation, and get back to you with a really specialized psychiatric advice, a specialized treatment plan that was, elaborated by the psychiatrist. So you could really avoid the long wait times for in-person assessments. For a psychiatrist, it's several months of waiting. So by, the support that we provide to our doctors and nurse practitioners, you could avoid that and really get specialized treatment plan. So we have at the moment psychiatrists, dermatologists, and pharmacists that are available. We're going to have more doctors coming in 2022. But please note that the consultations are not directly with the specialists. The specialists are really there to support the primary care providers, so the doctors and nurses with which you're having the consultations. The bridge to psychiatry. So what our primary care providers can do for you is really offer you some short-term supportive counseling. If you have to go back, 4 or 5 times, it's not a problem. We will really try to help you with your situation. We can help you with prescription management, psychology, and peer-to-peer referrals. Again, you could be referred to a psychologist or psychotherapist if need be. And what is great is that you have access to this service directly on the platform. So you could take an appointment with a psychologist directly on the platform. Please note that these consultations with a psychologist, social worker, psychotherapist are not free. You will have to pay for the consultation. However, if you have a group insurance or private insurance that covers mental health consultations, you could easily get reimbursed. Our primary care providers, on the other hand, this is unlimited and free, so you can reach out anytime you need. Psychiatry mentorship. So like I mentioned in the previous slide, we have a psychiatrist in-house that can really support our primary care providers and can offer all patients a deeper mental health support and tailored treatment plans. These are examples of what we could see on the platform to give you an idea. So on the first slide, the patient is suffering from stress, anxiety. They've been having trouble sleeping. So the nurse is asking if there has been any change in their life. And the patient explains that they've been given a lot more responsibilities at work lately. So what the nurse does is ask if the patient is feeling comfortable to start a video chat. And what could happen next is the clinician, the doctor or nurse could prescribe the patient a new medication or refer them to psychology appointment. And again, those psychologists, you can find appointments directly on the platform, so it's really easy. And we could follow up with you a couple weeks later to see if your medication is still adequate. Also in the second phone slide, it's a patient that suffers from high blood pressure and he's running out of medication. So what the nurses does is she asks for time to go back to their the previous consultation and then go back to the notes that is in the file of the patient. And she asks for a picture of the most recent blood pressure test, which the patient is able to do. And then the nurse says, okay, can we discuss, can we have a video call to discuss your refill? And also I want to give you advice and coaching on your blood pressure issues. So on the third slide, it's a patient that has a rash. So the doctor, the nurse asks for a picture. So if it's something that we can see, you can share the picture easily. It gives a better idea to the physician, and they can prescribe you, an appropriate medication. We know that the data that is stored on the application is very sensitive and is precious. So what we do is we have the highest certification level in the industry, and all information is stored in Canada. Not everybody has access to it. Really, the clinicians that are involved directly in your care can see your personal information at the time of the consult. And please note that even though your employer is paying for the service, no private information is sent directly to your employer. This is all private. It's the same as if you were going to your family doctors or a medical clinic. Your information remains confidential at all times. The consult details and notes can be shared with a family doctor if you wish. We would then need your written consent to share it. And children need to be present anytime a consultation is initiated for them. This is to really, for the clinician to be able to assess your children's symptoms and make sure that we are identifying the right person. To set up your account, it's really easy. Really, you receive a unique activation link, such as the one you see on the first slide. You just have to click on activate your account, the purple button, which will bring you to the App Store or the Google Play to download the application. If you prefer, you can use the web version of the service and use the service on your computer. Once you have downloaded or you're using the web portal, you're going to have to create your profile. So we're going to ask you for general information and also medical history. So if you have allergies, if you're already taking some medications, if you have health concerns, we should know for your consultation. So this is what we will need to know to set up your profile. Once your profile is set up, you're going to be able to log in and initiate a consultation with a physician anytime you want. So to add your family members, it's really easy. So again, it's your immediate family only. If you click on the profile section at the bottom right, you're going to see Manage Family. If you click on this, you're going to be able to add your spouse's email address, and your spouse will receive a activation link, which they're going to be able to click on, download the platform, and set up their own profile, which is going to be separated from yours. So for children, it's a similar process. If your child is over 16 or in Quebec over 14, then you would have to put their email address and they would be able to create their own profile and use the service on their own. If they're under 16 or in Quebec under 14, then the child is added directly to your application, to your profile. And if you have invited a partner, the child's profile is going to be shared between you and your partner. So if you're not there, your partner can initiate a consultation for your child. So when you start a consultation, the nurses will simply ask, is a consultation for you or your child? And then you can specify for who you're reaching out to at the moment. So that sums up the service, the virtual care service. I hope you appreciated this presentation, and I thank you for very much for listening. Have a great day.